Good morning, everyone. Welcome to our presentation on Prometric Exam Preparation. Today, we'll be focusing on a crucial question for 2025 that you must know to succeed. We'll briefly go over the key strategies and tips to help you prepare effectively. I'm excited to share this information with you, so let's get started. Let's take a look at the correct answer for this question. The antidote for a morphine overdose is naloxone, which is option B. This medication works by rapidly reversing the effects of opioids like morphine. It binds to the same receptors in the brain, but does not activate them, effectively blocking the narcotic's impact. Recognizing the need for naloxone is crucial in emergency situations to prevent respiratory depression and potentially save a life. Remember, quick administration is key when dealing with opioid overdoses. This point ties back to our overall theme of understanding emergency responses and the importance of knowing the right interventions. Let's talk about the antidote for morphine overdose. The options listed include atropine, naloxone, digibind, and protamine. Now, among these, the correct answer is naloxone. This is a crucial point because naloxone is specifically designed to reverse opioid overdoses, including morphine. When someone has taken too much morphine, naloxone works by quickly binding to the opioid receptors in the brain, effectively displacing the morphine and reversing its effects. It's important to remember that naloxone is often administered as an emergency measure by healthcare professionals, first responders, or even bystanders trained in its use. The other options, like atropine, digibind, and protamine, are used for different types of poisonings or conditions. They're not effective against opioid overdoses. So, understanding this distinction is key in recognizing the right antidote in an emergency. This slide reinforces the importance of knowing how to quickly identify and administer the correct treatment in cases of opioid overdose, which ties into our overall theme of emergency management and patient safety. Naloxone is an opioid antagonist, which means it works by blocking the effects of opioids in the body. Specifically, it can reverse the effects of drugs like morphine and other opioids that depress the central nervous system. It does this by binding to the same receptors in the brain that opioids target, effectively preventing these drugs from causing their usual effects. This is especially important in overdose situations because it can quickly restore breathing, which is often severely impaired during an opioid overdose. The key point here is that naloxone acts rapidly to counteract the life-threatening effects of opioids, making it an essential tool in saving lives. So, when we ask, why naloxone? It's because of its ability to quickly reverse dangerous respiratory depression caused by opioid overdose. Understanding how it works helps us appreciate its vital role in emergency response and overdose prevention efforts. Now, let's take a closer look at some of the key signs of morphine toxicity to watch out for. One of the most serious is respiratory depression, which means slow or shallow breathing. When someone's breathing becomes significantly slowed, it can be life-threatening. Another critical sign is pinpoint pupils, where the pupils become very small and constricted. This is a classic indicator of opioid overdose. Additionally, severe drowsiness or even unresponsiveness can occur, meaning the person might be difficult to wake or completely unconscious. Recognizing these signs early is essential, as they indicate that the body is struggling to handle the medication safely. Understanding these symptoms helps us prevent serious complications and ensure timely intervention. Now let's talk about administering naloxone, which can be given IV, IM, or SC, depending on the order. It's important to follow the specific instructions provided to ensure the medication is given safely and effectively. After administration, I always monitor the patient's respiratory rate and oxygen saturation closely. These are critical indicators of how well the patient is responding to the naloxone and whether their breathing is improving. Remember, naloxone has a relatively short duration of action, so the patient may need repeated doses. That's why continuous monitoring is essential until we are confident that their condition is stable. These nursing considerations are vital because they help us respond promptly to any changes and ensure the safety of the patient throughout the process. Staying vigilant and attentive is key to managing potential setbacks and ensuring a positive outcome. Let's talk about what happens in a morphine overdose. It can lead to respiratory depression, which means breathing becomes dangerously slow or even stops. Fortunately, there's an effective antidote called naloxone. It's a fast-acting medication that can quickly reverse the effects of opioid overdose and is truly life-saving. However, it's crucial to remember that after administering naloxone, close monitoring of the patient is essential. This ensures their safety and allows for additional care if needed. In summary, understanding these points highlights the importance of prompt recognition and response in opioid overdoses, which is key to saving lives.